So we've gone through the vertebral bones that are going to make up the axial part of the skeleton. But let's go ahead and let's move a little bit lateral to that, and let's talk about the other bones that are going to make up the axial part of the skeleton, and that's going to be what's going to comprise the thoracic cage and the pelvis. And we'll start with the central bone, or the most medial bone, which will be the sternum. The sternum is made up of three parts. The first part would be the body. Superior to the body, we have the manubrium. The manubrium is right where you see the little notch in your throat region, in your cervical region of the anterior part of your body, or the ventral part of your body. And then we have the xiphoid process. The xiphoid process is that little bony spot you feel right at the inferior aspect of the sternum. That is the spot that we look for when we're attempting to do any type of chest compressions during resuscitation of a patient. Connecting the sternum to the rest of the bones of the thoracic cage will be the costal cartilage. The costal cartilage is made up of hyaline cartilage. There is one costal cartilage for each of the true costals. And then there's one costal cartilage for all of the false costals. And so when we look at the costals, there will be 12. There is the first. And here is the 12th. The first, second, 11th, and 12th are sometimes referred to as atypical costals, and you'll see that in reference sometimes. However, we use a different recognition for costals when it comes to the kinematics of the thoracic cage, in which costals 1 through 7 are the true costals. 8 through 10 are the false costals. And then the final two, 11 and 12, are the floating costals. This idea of true, false, and floating is how they are connected to the sternum through the costal cartilage, in which true costals are in a one-to-one relationship, whereas false costals are going to not have that one-to-one ratio. It'll be a 1-to-3 ratio in terms of costal cartilage to costals. And floating are not connected at all to the costal cartilage. This kinematic idea of true, false, and floating comes into play when we look at diaphragmatic action and motion of the thoracic cage during ventilation processes. And so let's take a look at the other bones that we'll see within the thoracic cage. And so we'll start with the most inferior bones, which are the floating costals. Then we get to the false costals, and then the true costals. And then the other bones that we'll see with the thoracic cage, such as the scapula, the sternum, and the clavicle. The last bit of structure we can look at as it relates to the thorax is going to be the pelvis itself. We're not going to look individually at the bones and the bone landmarks here, but we're going to look specifically at the pelvis, because the pelvis is going to establish the platform for the thorax. In this, we have two distinct differentiations that we make within the pelvis. We always refer to as the false pelvis and the true pelvis. The true pelvis is going to be the inferior aspect bordered by all three bones that forms the inferior opening through the pelvis, whereas the false pelvis is the superior aspect of the pelvic structure that is predominantly the iliac bone itself in terms of its internal bony surface. We have three bones that we'll see making up the pelvis beyond the sacrum and the coccygeals. We have the ilium, the pubis, and the ischium. Junctioning the right and left pelvis will be the pubic symphysis. Now, the pelvis itself is independent of each other, even though we look at it as being a fused structure. It is actually held in place by a large number of ligaments and fibrocartilage, like we see with the pubic symphysis. The right and left pelvis themselves are independent of each other in terms of motion, and this is what allows the pelvis to rotate as we take steps in order to locomote, in order to walk or run. The other principal landmarks that we can see across the pelvic structure itself will be the obturator foramen, and then the junction point that we see with the pelvis to the lower extremity, and that would be the acetabulum.